Thanks very much. Everyone and the Executive today has considered the grave and serious situation which we currently find ourselves. I've been clear with you in recent weeks about the steep rise in positive cases of COVID-19, and we know the speed and the relentless nature of this virus. We also know that it takes action from each of us to stop it in its tracks. So we are seeing a progressive rise in hospital admissions, and if we allow that to run unchecked, these are predicted to exceed those of the first wave before this month is finished. That would be hundreds of people requiring hospital treatment within the next 2 or 3 weeks, and a growing proportion will require the care that can only be provided in our intensive care units. I know that there is a small band of voices who feel that the risk from COVID-19 is not really all that serious. And indeed, it may be easy to hold that view if you feel that you're not in what is considered a vulnerable group. But it's untrue. And you only have to look at how other countries around the world have fared to see the terrible toll that it has taken on lives. And look closer to home and think about how an NHS overwhelmed by COVID-19 will impact on those with other serious and long-term ill health, people with heart conditions, people suffering from cancer and strokes, for example. They too will also pay the price for complacency of others. So today, the Executive has made a number of decisions that will strengthen the current interventions to increase their effectiveness in trying to curb the spread of this virus. So firstly, we've extended the settings where face coverings must be worn, in addition to public transport, retail and hospitality environments. We've agreed that they must be worn when boarding a plane, in taxis and private buses, if visiting government offices such as benefit offices, and banks, building societies and credit unions, and both driving instructors and their clients should wear face coverings. These are mandatory requirements, but I would encourage everyone to wear a face covering in any setting where social distancing is not possible, where there are large crowds, where ventilation is poor, or if you're in a confined space for a long period of time. That's simply common sense. But for those who think that these and broader health regulations do not apply to them and want to ignore them, then the consequences from today will be more serious. The Justice Minister has advised us that the police has to date issued 1,156 £60 fines for breach of public health regulations. They have issued 203 prohibition notices for licensed premises or for restrictions of gatherings in a private dwelling. And they've issued 27 £1,000 fines for failure to self-isolate following international travel. And today the Executive has agreed a new regime of penalties. The existing fixed penalty notices for breaches of the regulations, which started at £60, doubling up thereafter, will instead be replaced by a single tariff of £200 for a fixed penalty notice. 3 other offences will be punishable on conviction by a fine of up to £10,000 or attract a fixed penalty notice starting at £1,000 and then laddering up to a maximum of £10,000. The first of these is not closing a business as required under the regulations. And there are 2 other new offences we are introducing. These are breaching the early closing requirements for hospitality, and secondly, not implementing measures to maintain social distancing. The Justice Minister and the Executive are also giving further consideration to an offence relating to organising a large gathering or an unlicensed event as applies in England and Wales. Now, it will always be our preference, rather than face penalties, people would listen and work with us and support our shared effort to save lives. So the Strategic Enforcement Group, led by our junior ministers, are bringing together a range of partners, including business and civic leaders, along with those with responsibility for enforcement, to try and develop a joined-up programme of work that will support people to do the right thing. And I do want to say thank you to the vast majority of people who follow both the letter and the spirit of the current public health regulations and guidance. Your efforts are protecting lives and livelihoods. Now, I know that the people of Northern Ireland are sensible and pragmatic, and above all, caring and kind, and that most carefully follow the simple steps to stop infection spreading. But our circumstances require action from everyone. We all have a responsibility to reduce the spread. And in closing, I do want to be upfront with all of you. The Executive is concerned about the direction of travel set out today by our medical and scientific experts. It's clear that there's a rising curve of cases and hospitalisations, and we will be taking a significant strategic stocktake of the situation and the actions needed to drive down the curve of infection. And there's no doubt that we, together with leaders right across the United Kingdom and beyond, are facing some of the toughest decisions we will ever have to in the days ahead. So I'm saying to everyone that how far and how hard the Executive will have to go depends on your actions today, tomorrow, over the weekend and the week ahead. So let's all work together and let's try to bring that curve down.